The attraction of companies and talent to northern Delaware, southern New Jersey, and southeastern Pennsylvania is, well, contagious. Just last week, Iovance Biotherapeutics, a growing biopharma company focused on the development of novel cancer immunotherapies through what is known as adoptive T-cell therapy, announced their plans to establish operations at the Navy Yard, an incredible business park located just 3 miles from here in beautiful South Philadelphia. Iovance is investing $75 million to start, to build a brand new 136,000 square foot commercial scale production facility here in Philadelphia, and is expected to create employment opportunities for several hundred individuals in Philadelphia once it is at full capacity. The new facility is set to open by the end of 2021. With headquarters in San Carlos, California, an office in New York City, and a research facility in Tampa, Florida, the team at Iovance recognizes that if they are serious about developing solutions through T-cell therapies, they need to be here in Greater Philadelphia. Iovance President and Chief Executive Officer, Dr. Maria Fardis, is here to share more with us about why Greater Philadelphia is the best fit for their growing operation. Dr. Fardis.
Thank you. I don't think I can beat that introduction, so this is perfect. Thank you. Good afternoon, everyone. Thank you for having us here. I know a lot of people who spoke here today are here because they've been here and deep-rooted, and you're correct that we have not been. We are the new kid on the block. We have headquarters in San Carlos, California. For people who don't know where that is, it's 15 minutes south of San Francisco, and for people who still don't know where that is, it's half an hour north of Apple headquarters. Everybody knows that. So we did not have any business being here. We had offices in New York. We have offices in Tampa, Florida, which is our research and development facility. And we are here by design. We spent a significant amount of time looking for a new facility, and we truly found Philadelphia the best. We spent quite a bit of time looking at multiple cities, multiple states. Many states provided a lot of incentives, and yet we chose to be here. From a company perspective, we are a public company. We are a market cap of $2 billion. We are fairly small from a size perspective. We have about 120 employees. We are in the business of developing cell therapies for solid tumors, and we definitely did not have a business being here. The technology itself came from National Cancer Institute in Washington, and our corporate headquarters being in California. So you can understand why after having heard everybody else, you can understand why it is that we chose to come here. It was a talent pool. Definitely on the top of the list, the infrastructure that the city offered, the hospitality, and the fact that we had a corporate general counsel here all helped. The reputation of Dr. June certainly was something that carries quite a bit. We spend a lot of time developing drugs for solid tumor patients. Specifically, we are working on metastatic melanoma, patients who have failed all available care, and cervical cancer patients who also have no options for treatment. We showed some of our data at a conference that I just came from called ASCO. It's probably the largest oncology conferences, and there was a significant amount of interest and buzz around the product that we are working on. We chose Philadelphia for the reasons I mentioned. We plan on building a 136,000 square foot manufacturing facility, as was mentioned before. And I think the pictures may be up there, if I can just click through them. Our manufacturing process is very much individualized. Our product is patient by patient. So there's a lot of technical skill set that goes into the process. And we currently work with a CMO, which is out in Philadelphia. So we chose the Navy Yard because we were close to WuXi, which is our current manufacturing organization. The process is very much individualized. It's patients' own cells that we take out, we expand, and then we bring back to the patient. To show you what this facility looks like once the manufacturing is completed, this is one side of the facility. It's going to be a butterfly design where we would open up half the facility, and as we get more patients in the commercial landscape, we open the other side of the facility up. We are able to provide product for up to thousands of patients, and we believe that we are going to employ hundreds of technically very expertise cell therapy individuals in our cell therapy facility. So after showing you sort of what it looks like, we are just delighted to be here. We are pleased. Thank you for being excellent hosts already. And I just wanted to thank you. We are going to be here as your new neighbors and We are delighted, and it's by design. It's not a coincidence. Thank you again. Thank you. Thank you so much.